Ashley and EatWell Exchange has been very instrumental in assisting me with that change in my practice. So I'm very big on referring my patients for nutrition counseling and education.
You're going to be cooking in groups today. So whoever's at your table, that's who you're going to be cooking with. So make sure you sat next to somebody that can cook, okay? So here's your recipe cards. The recipe was enhanced by Enoch to make it taste really, really, really good, because we know that a lot of times when we think about eating healthy, we don't think about foods having a lot of flavor. So we're doing the opposite of that. Because when you cook at home, you're more likely going to have healthier options. When you go out to eat, it's typically going to have more fat, more sodium than you do at home. And that's because when you go out to eat, their goal is to make you come back. And the food that makes you come back is the food that's high in sodium, high in fat, high in sugar. So we want to make sure we give ourselves foods that are going to be good and nourishing for our body, but also not have a lot of sodium, fat, or sugar.
How you doing? I'm Dr. Bernard Ashby. We learn nothing about nutrition in medical school. If y'all go to the doctor, how many times has the doctor actually talked to you about nutrition? How many times has your doctor talked to you about medication? Yeah, and that is a problem with our healthcare system as it relates to our people. We have every right not to trust the healthcare system because it doesn't serve us. It doesn't align with our value. It is a for-profit industry, and if you don't have insurance, it will Jeff you out of there so quick. Once I left the institution, that's when I realized I needed to start learning from my community, learning from my ancestors, and still practicing evidence-based medicine. The two are not mutually exclusive. And one of the things that I learned was that food is your medicine, and food is also your poison. The way I frame it to my patients, I'll only give you medication only if I have to. One, and two, you're the CEO of your body. I'm just a consultant, and all I gotta do is make the recommendation. And if you're able to be disciplined enough to take control of your health, how you treat your body, how much you move, how much fresh air you got, how much sunshine you get, because the vitamin D deficiency is epidemic, so y'all need to get outside even though y'all in Miami. How much calories you take in and what kind of calories you take in. Once you're able to do that, then a lot of problems will get solved.
All right.